Hello, I'm Ann Welton. I'm on the board of the Friends of the Northern Wake Senior Center, and I'm here today with Jason Burgess of Senior Plan Advisors. I've known Jason for many, many years. He's a respected member of the community, member of the Chamber of Commerce, and he's a real asset to our senior community. Jason, welcome.
Well, thank you.
Tell us a little bit about Senior Plan Advisors and yourself.
Okay, so I'm Jason Burgess. I live here in Wake Forest with my family. I have a wife and 3 children. Some are getting on up in age, high schoolers and one in college, but we've been here for going on 14 years. And my company is Senior Plan Advisors. We are independent brokers, insurance agency that handles Medicare coverage. So I spend most of my day explaining Medicare, answering questions, and helping people through that process.
Well, I'm glad you're here today because I want you to explain Medicare to us. Tell us, what is Medicare? Who qualifies?
Good question. So Medicare is the federal insurance program for people who are turning 65 or people who have certain disabilities. So what it is, it's not Medicaid. A lot of people confuse it with Medicaid. Medicaid is administered by the state, and it's for people of all ages with lower income.
Okay.
Some people can have Medicare and Medicaid, but Medicare is the federal insurance program that the U.S. government has. We all pay in, if you're working, you pay in FICA taxes over the years. And that goes to Social Security and Medicare. So people who are eligible are people who are Medicare eligible, or people who are Social Security eligible. And the qualifications for that is you have to have put in for 40 quarters of FICA taxes over your working life. You or your spouse who you've been married to for at least 10 years. So to answer your question, what is Medicare? It's the federal government's insurance program that's provided by FICA taxes. When people with payroll taxes, when they pay in for up to 40 quarters, or their spouse does. Who is eligible? Anyone turning 65 that Social Security eligible is, and then also people with certain disabilities. Another people that get Medicare is someone who is on federal government disability. On the 24th month, they become Medicare eligible.
Interesting. Well, when someone's about to turn 65, what do they need to do? How do they get Medicare?
Good question. So the easiest way to apply for your Medicare, and this is for people turning 65, you can do it this way, is to apply online. You have to have an SSA.gov, that's Social Security Administration's website, sign in. So you would do that and you apply for your Medicare through there. We help a lot of people do that. I help a number of people do that every week. And so that's the easiest way, is SSA.gov. Use your login and apply there. You can do that 3 months prior to the month you turn 65. So for example, if you turn 65 on March 13th, you'd be Medicare eligible on March 1st. You can actually apply back up to February, January, and December. So 3 months prior to, you can go in and apply for your Medicare. The other way you can do it is you can go into the Social Security office, but I would just suggest blocking off most of your day. And you can do it over the phone with Social Security. You would contact Social Security Administration, tell them you want to apply for Medicare, and set up an appointment, and they'll do a phone appointment with you. To answer the questions you have about Medicare, you can either talk to someone like me who is a local agent, or a good number to call is 1-800-MEDICARE. That's not as long as the main Social Security number that you call. You'll have to wait 45 minutes to an hour to get someone. But a lot of times with that 1-800-MEDICARE, you can get questions answered you get someone on the phone in about 10-15 minutes.
Oh, that's good to know.
Yeah.
So if you've had health insurance your entire life, why do you switch to Medicare? Why do you need
Good
to
question.
do this?
So if you're working full-time, let's just say you're coming up on 65 and you're like, I'm not going to retire till 68. You don't have to take your Medicare as long as you're working full-time and on a group health plan, or your spouse is working full-time and on a group health plan. You could put it off, and then when you do get ready to retire, you can apply for your Medicare then. So when you apply for delayed Medicare, it is a little different process. You fill out a form, your employer fills out a form, and you get that to Social Security. But that's another rabbit hole we could go down. We probably don't have time to today. So I would suggest if you have questions about that, you can reach out to someone like me to help with that if it's delayed Medicare.
Well, quickly, before we move on, I know that if you delay getting your Social Security benefits, they increase.
They do.
But is that the same with Medicare?
No, I get that question a lot. You don't have to take your Social Security when you get your Medicare. You can put that off.
Okay.
A lot of people are waiting until their full retirement age with Social Security, which now is about 66 and a half. Well, you become Medicare eligible at 65. So you could go ahead and apply and get your Medicare, and they'll bill you every quarter for you paying for your Medicare.
Oh, I see. Okay. So you might as well go ahead and do it if you're...
Yeah, as long as if you need to. If you don't have access to a group health plan, either through you working full-time or your spouse working full-time, you need to go ahead and take it, because if you don't, they're going to penalize you when you do take it.
Oh.
And they'll limit when you can get it. So that penalty is pretty severe too. So for anybody out there that's on like a regular healthcare.gov plan, like an Obamacare plan, or just has an individual policy, they need to go ahead and get their Medicare and get that ball rolling.
So tell me about how it covers prescriptions. Almost everybody has one or two prescriptions that they need to have covered.
Yeah, that's a good question. So Medicare has 4 parts, okay? And one of them not everybody takes, but when you apply for your Medicare, when you get it the full-on Medicare, you're going to get Part A, which is hospital coverage, Part B, as in boy, which is medical coverage, and then you're going to need to get Part D, which is drug coverage, okay? And so the Part C Advantage Plan is one of the options you get with the healthcare side, but so the healthcare side is just Part A hospital and Part B medical, okay? And the problem with just that is it only covered, in a nutshell, without getting too much into the weeds, for the medical side it only covers 80%, and it has deductibles with those. So you got gaps in it. So you're going to pick one of the 2 options to go to fill in those gaps. And that's why if you're turning 65 or you see all these ads on TV, it's insurance people or insurance companies trying to sell one of those 2 options to help with those holes in it. One of those options is a Part C Advantage Plan, okay? And it takes the Part A hospital coverage, the Part B medical coverage, and the Part D drug coverage, combines it into one plan, and then that company takes over, and they're your Medicare provider. That's one option, okay? Very low in cost. The other option a lot of people take is a Medicare supplement or a Medigap policy. Remember, the 2 options to fill in those gaps. And the Medicare supplement, how it works is it just follows that Part A hospital, Part B medical around and fills in those gaps for you, okay? And then if a Medicare supplement does not include drug coverage, so you'd get a standalone Part D drug plan. So back to your question, how does drug coverage work? You either get it one of 2 ways, either with a Part C Advantage Plan that includes drug coverage or a standalone Part D drug plan. And that's how it's administered. The drug coverage, only way you get drug coverage for Medicare is through one of these insurance companies that offers this coverage. Now, it works very similar to like you have with say work coverage you'd have. They tier the drugs. Like more expensive drugs are going to be tier 3 or 4, and you pay a copayment on those drugs, whatever tier they are. And that's how Part D works. But Part D Medicare coverage can be confusing, and we could do a whole nother podcast on the donut hole and the coverage gap and how all that works. But it can be complex. But this has been my experience for people coming off of group health plans and other insurance company plans going on to Medicare. First thing is the healthcare coverage is probably going to be better, okay? And in a lot of cases, a lot cheaper as far as how much it costs you monthly. The second thing is if you're taking expensive medications, it can be more expensive when you get to Part D drug coverage to Medicare. So the health coverage side is going to be better, a lot of times less expensive. The Part D drug coverage, if you're taking expensive medications, can be more expensive because you got to deal with things like the donut hole and coverage gaps with that. That's a whole nother complex thing.
So I understand one of the services that your company offers is looking at people's specific prescriptions and what their needs are, and then recommending which way to go.
Right.
Is that correct?
That's a good question because you need to look at that every year, and that's one of the benefits of having a local agent like us. Is prescription coverage can be complex, and there's different data we can use. If you know, a good agent's going to know how to get data to use to project out and say, so if you're taking an insulin, right, a particular insulin. Now, insulins are pretty expensive. If you don't have coverage, they're $400 or $500, right? A lot of them are. And so, as the year progresses, a lot of times stuff like that's going to put you in what they call the donut hole, so the cost of that can go up, okay? So one of the benefits of having a local agent is knowing what you're getting into. A lot of people just sign up with someone over the phone. They're not researching it, and to know where you are with that. But yeah, that is one of the benefits of having, say, senior plan advisors, is to look at the prescriptions, because that can be complex and it can cost you hundreds, maybe thousands of dollars if you make the wrong decision with that. Not to scare, I hate to scare people, but
no, but
yeah.
I mean, that's what you're here for,
right.
Not to scare people, but you're here to help.
That's right, that's right.
So I think if someone is about to turn 65 and getting on Medicare, you're a great option for looking at their options.
Yeah, so
but what if you've been on Medicare with specific supplemental or drug plans for several years? Can you help someone like that?
Yeah, it's good to look at it every year.
Okay.
Now, in the case of a Medicare supplement, okay? So Medicare supplements are, remember that was option 2. That's the one that follows around and fills in the gaps with Medicare, the original Medicare A and B medical side. Medicare supplements following around. So Medicare supplement coverage is standardized. So the most popular supplement right now is a Plan G, right? That's the one we recommend, and that's the one most of our clients take. So a Plan G with Blue Cross Blue Shield is the exact same coverage with Mutual of Omaha or Aetna or United Healthcare. So it's standardized coverage. So all they vary in is their premiums. And so the premiums can vary as they go up with age. That's one thing you need to look at when you're looking at a Medicare supplement company. A lot of them are really cheap up front, but then when you get to 68, 69, it's going to really jump up on you. The problem with that is if you have some underlying health issues, you may not be able to get another supplement. So choosing wisely is important. But yeah, we do help a lot of people who come by our call and say, I just need to relook at this. I've had this plan forever. Am I on what's best for me? And we do a lot of that for folks.
So you are a wealth of information, seriously, and it is complicated.
Yes.
So I highly recommend anyone who's watching this podcast to reach out to Jason, and very quickly, at no cost, you can assess the situation and make recommendations or recommend that they stay on what they're doing.
Right. Yeah, we do that a lot. A lot of people are all set when we do it, but if it's something that we see that could benefit them, we recommend changing it. So.
And is there a cost to a client to come and visit with you?
No, and that's a good question. So the question that we get asked a lot is, what does it cost to deal with a local agent? So there's 2 ways you can go about this route, okay? So first thing you need to do is get your Medicare in place. That's the federal government, okay? So you get that in place, and if you're dealing with a good agent, they're gonna help you do that. They know the process to do that. And then you gotta choose which one of those 2 options best fits you and your needs or your budget, okay? So when you pick those options, then you need to pick a company, right? And there's 2 ways you can do it. You can either go straight to the company, like you could go straight to United Healthcare or Blue Cross, deal with them over the phone, and call the 800 number. Or you can deal through a local agent like us. Doesn't cost you any different. So to answer your question, it doesn't cost my clients any money to have me as their local resource. So obviously it's nice, we feel like, to have a local agent. We spend a lot of our day answering questions, and especially new folks, you get on and you're like, it takes a few months to get in the flow of things. And so we spend a lot of our day answering questions and helping them walk through it. So, and they have local folks to help them with it. So.
Well, you are a great local resource, and I can say from experience, he's wonderful to work with and accessible and willing to answer or find the answers for anything that you might have around Medicare. So, highly recommend Jason Burgess with Senior Plan Advisors, an office on South Main Street right in downtown Wake Forest.
Yeah.
And how can people get in touch with you?
Our number is 919-435-1801, or you can email me at jason@seniorplanadvisors.com.
Thank you so much for being here today.
Thank you, and for all you do for our community.
Oh, my pleasure.